Welcome to this episode of NLN Nursing Edge Unscripted, our podcast featuring our scholarship track. Unscripted Conversations Scholarship celebrates the published work of select nurse educators from the NLN's official journal, Nursing Education Perspectives, as well as the Division of Innovation and Education Excellence and our Nursing Edge blog. The conversations we have in these podcasts embrace the author's unique perspectives on teaching, learning innovations, and the implications for nursing program development and enhancement. Today's episode is entitled Developing a Social Determinants of Learning Framework, a case study, and will focus on the unique perspectives of the authors who published this manuscript in the July-August 2021 issue of Nursing Education Perspectives. So joining me today are Dr. Carla Sanderson, Provost from Chamberlain University, and she is our primary author on this manuscript. Joining her is author Dr. Linda Hollinger-Smith, Associate Provost, Institutional Effectiveness, Accreditation and Research at Chamberlain University. And joining both of them, and also an author on the manuscript, is their president, Dr. Karen Cox. Thank you all for joining me today. Looking forward to this dialogue.
Thank you.
So let's begin, because this is, really a compelling topic, especially with all that our country's been going through lately, and as we begin another academic year with COVID and all of the issues around diversity, equity, and inclusivity facing us. The work of educational justice with denouncing racism, embracing just principles, identifying and addressing the underlying unjust and avoidable social causes that really disadvantage our learners. You write about this in this manuscript. And you also begin to suggest that a conceptual framework that might be rooted in the context of systemic racism may promote a shared understanding in language. So again, really timely and an important conversation that's happening, and addressing it head on relative to teaching and learning in academia is really imperative. I'd like you to share with us about how you as the authors came together on this issue to then develop a framework to address learning disparities. What piqued your interest? How did you come together to develop this work?
Thanks, Sue. I'll take that one. And certainly my co-authors can join in. Several years ago, Dr. Hollinger-Smith led research around NCLEX success. And with 700 students, we have a very large BSN program. And what was found was that only about 30% of their success was academic in nature, related to their academic background and performance. But the rest were factors that were non-academic, things like where they live, where they work, do they have to work full-time and go to school full-time? Many of the things that we know intuitively, some students have more challenges than others. And so from that study, there was just this interest in seeing, okay, our student body is diverse, and it's about 60% diverse, which is high. We're the largest grantor of BSNs to underrepresented minorities in the US. And we take that very seriously. And we know that we have students, diverse or not, that haven't had all the advantages that many of us have had. They maybe went to low resource high schools. They are in areas where they are not secure in their housing. They're concerned about safety. They don't necessarily have access to healthy food, all the things that we take for granted. And so when you pile all that on to a student in nursing, it's important that we look at that and address that. And it's particularly important because for years we've talked about in nursing the need for diversity, and we've made some progress, but I would say not the progress we need. And the more diverse we are, the better we will be. And we know from the Future of Nursing report, health equity is really important. And we at Chamberlain are taking that full on and working hard to ensure that our students are prepared and that we can add extraordinary nurses to the workforce.
Yeah, I would just add to Karen's comments there, the university provided the research team a laboratory for figuring this out. I think I'm a career academic myself, and I think we have intuitively known a lot of what we have now statistically suggested, but to be able to have the size in that we had in this study, the results were very compelling. Like Karen said, over 60% of the variables impacting success are social in nature. Well, that was pretty liberating to find out that some of our my own biases and so forth about what it took to be a successful nursing student were removed. These are social factors. We can address these. So the work then from the study forward has been directed toward those social factors, and Linda's own research in some similar areas really then were able to get us focused on how we could approach this.
So 60% is really high. I mean, when you think about all of that, so I can see where you'd be surprised and amazed by that. And you mentioned something, Dr. Sanderson, about your colleague, Dr. Hollinger-Smith's research. I'm wondering if she could share a little bit about what the intersection of her work is with this.
Sure, thank you. Well, I think what was important for me to look at as we were developing this framework, and we were looking at a lot of our early research, as Karen mentioned, being able to predict success of our students on NCLEX, was that we looked at it kind of more holistically. In other words, we didn't just want to look at student factors, but also institutional factors. That includes looking at, the relationship, the engagement of students with faculty was important. The whole culture of an academic institution also impacts, students. And I think from that really kind of solidified it for me, looking at these we call non-academic factors. Again, in the model, we identify the psychosocial factors, the self-motivation of students, and again, how that intersects as using the social determinants of health framework kind of as a foundation for what we're looking at, and that relationship between health, whether again it's physical, psychosocial, and so forth, environmental, and how that intersects with education, I think is really key. And that again was very much foundational for what we looked at in our previous research, and again identifying those academic as well as those non-academic factors impacting student success.
Recently, you're seeing a lot more in the literature around this notion of resilience as a factor in students overcoming barriers, and this notion of grit, and this 60% of factors that are not related to academic issues, but more of their social issues really plays into that notion. Has that been a dialogue, or talk to me a little bit about have you read or seen things like that in the literature, and what your thoughts might be about that?
Yeah, definitely resilience is an important element. And one of our studies, and I'll be happy to share several others that we've been looking at over the past several years, but we developed for our students, our pre-licensure BSN students, what we call CEAP, which stands for Chamberlain Early Assessment Program. And it's basically a survey of students looking at again, the non-academic factors, their adversities they had experienced over a lifetime, and again, that's impacting them currently as their students from their admission onward throughout the program. And resilience was an important factor. That's actually one area that I've studied before I even came to Chamberlain, looking at resilience of nurses and CNAs working in long-term care and senior living settings, and developed a tool to really measure that, and looking at some of those components. And resilience itself, it's a multifactorial concept. So within that tool, we look at elements such as social support systems. For example, the student's level of self-confidence, their self-efficacy, and so forth. But one really interesting finding, and this is one area where I'd like us to explore further, and it was one of those kind of aha moments when you're doing research. And I was looking again at our longitudinal study that we're now just completed, but looking at students who don't succeed, who may fail on NCLEX, for instance, or who attrit early in our program, that a lot of those students actually self-reported very high scores. In other words, they felt very self-confident coming into the program. They felt that they could set goals for themselves and so forth. So their scores on our CEAP measures were actually much higher than expected, and actually higher than many of the students who passed NCLEX and succeed in the program. And what I attribute that to is, when we look at self-affirmation theory, and how can we support students, that that's almost they consider that kind of a self-defense mechanism, if you will. So students that feel that they do have that, inner being, in terms of, again, feeling that they are confident in what they're doing and coming into a nursing program, but maybe they're weaker on the academic side. How can we support students in that respect and really help, boost their self-confidence, their resilience, because that does very much interact and impact how they then perform academically in many cases.
Just to add to that, when we are talking about social justice and education in nursing, it really does come back to the holistic admissions process. We're still, as a society, leaving hundreds of thousands of qualified applicants out of nursing because of lack of openings in schools. And if we don't do holistic admissions, we're going to have all of the people who have a 3.8, 3.9 GPA. And when it comes to resilience, when we look at the admissions and look at the files of these students coming in, resilience is their middle name. I mean, they've dealt with life challenges that many of us have never dealt with. And yet here they are, ready, willing, and able, with the support that we've been talking about, and to go through program and be successful and become a nurse.
Yeah, I mean, that feeds right into this notion of the social determinants of health, as we found just in our work in community nursing, across. And that really was the foundation upon which you built the social determinants of learning framework. That relationship between health and education are really clear. And you also mentioned in the manuscript a little bit about Healthy People 2020 and how that addresses these social determinants of health. So as you discuss the research and the conversations on that, the social determinants of health have really impacted health systems change. And as nurses, we understand the relationship between health and education. So talk to us about how you see the social determinants of learning framework in guiding research and conversations moving forward to assist change in academic settings.
Mm-hmm. Yeah, thank you. I can take that question, Amy. So overall, we're taking a translational study approach to develop and test the social determinants of learning framework. so that the results of that can be implemented to be able to inform as well as influence educators as they're looking at providing how they can provide service, remediation, or resources to our students. And if I can first just talk to you a little bit about sort of the theoretical background and the scoping review we conducted to better understand the extent and the depth of the research that's been conducted in relationship to those domains and the attributes within the framework. And then I'll talk a little bit about some of the research, again, that we've been involved with at Chamberlain University and how it's been informing our programming and interventions we've been, again, developing in order to really foster this equitable educational environment, as Karen talks about, for all of our students, and then again, be able to enhance their academic success. So we, basically started with looking at the literature and trying to find a theoretical foundation for the framework and also research that we wanted to conduct. And I looked into, again, the research, of course, in sociology of education and so forth. And Dr. Owe Sorensen, who passed away, unfortunately, a few years ago, but he was a leading authority on the sociology of education. He's from Harvard University. He developed a theory that looked at the structural basis of social inequality, again, looking at it from the perspective of economic factors and how that really impacts. And from that, there's been studies done by several other researchers to really take that theory and operationalize it. And two researchers from University of Sydney, Dr. Ryan Naylor and Dr. Nathan Midsood, tested his theoretical framework, and they identified different aspects of the culture of universities, as well as activities that may, again, promote perceived inequalities among different groups of students. And their hypothesis was because students come from us from various backgrounds, and we see that with our own students, again, many non-traditional coming into nursing, second careers and so forth, but coming from different backgrounds, they interact with aspects of a university differently. And so that results in different experiences that they all may have. So when we try to look at, for instance, potential sources of structural inequality within a university environment, those can again relate to faculty, to fellow students, the curricula, activities, administration. So again, just some examples. And why this is really important to note from both a research and academic perspective is that more and more we're seeing that the institutional factors compared to student factors may be stronger predictors of student outcomes, including retention and success. And looking at, again, from the academic research perspective, most of the studies have really focused on student factors primarily, and we've seen a gap in the research that have looked at the impact of structural, institutional structures from, again, the environment of the academic environment, the culture, the preparation and experience of faculty, just to name a few. And so our social determinants of learning framework includes those additional factors that we've been studying and looking at. And again, in terms of some of the research that we've been doing to again address and inform the work and guide us in the future, we want to have an approach where we can look and partner with other academic institutions, with other nursing colleges, to really bring a lot of this research forward. So part of, I think, publishing this article and having this opportunity is one of where we can open up the doors and invite other researchers to really join forces with us. But in some of the studies that we've been looking at, I've mentioned CEAP already. From the results of our Chamberlain Early Assessment Program, we've developed interventions to promote student success and are testing those interventions. We've called those care connections. And the first one we've implemented is that of developing, focusing on a mindfulness program for our pre-licensure BSN students. And this very much ties in with what we talked about already in terms of bolstering resilience of our students. And also it focuses itself on helping our students be able to focus more on their studies, because again, many of them are working full time. They've got families. There's a lot of other things happening in their lives beyond school, and also reduce stress and anxiety. And so that primarily focuses on our social determinant of learning domain of psychosocial. And we saw, again, very positive outcomes, reduced stress and anxiety, as well as seeing more positive feedback from students related to their courses and instructors. And so from that, we're planning to develop additional Care Connections programs. We're looking specifically in the area of students' sense of belonging. So that relates to students feeling valued, accepted, and part of things within a university environment. And also motivation for learning. That's going to be actually a faculty-facing program, so faculty can learn how to support students so they can grow as self-directed lifelong learners. So again, just some of the examples of, again, how we've been implementing what we put together within this framework. And we see the framework itself as something very malleable. It's not set in stone, in other words. So from what research we're conducting, and again, hopefully having additional partners in these studies, we see that the framework really evolving, if you will, over time, I think.
You mentioned, this focus, these caring connections, and I can't help but think of how valuable a framework like this might be as we think about that transition to practice, and how do we prevent our novice nurses and the attrition from healthcare systems within the first year of practice. And sometimes, just the cultural aspect of your framework and how much the culture impacts the individual. And nursing as a profession is unfortunately not typically known to have a nice culture within the way we develop our collegiality, a little bit harsh. And so I'm just curious about what your thoughts might be about that.
We can all take that. I'll jump in. I do think, Sue, that the way we were able to do what we've done is because we were building on a previously established, what we call culture of care. The commitment to do nursing education differently is really at the origins of Chamberlain University, a belief that all students can learn, a belief that students who want to be nurses can become nurses, and hiring faculty members who believe that too has really laid the foundation for now this work that we're doing in creating the strategies and so forth to deliver to our students what we have established as our culture.
And I'd like to add, from my service perspective, from being in leadership roles in hospitals, one of the things that we think is a factor in first-year turnover is the fact that no one really, in an organized way, helps students make decisions about where they're going to work. And if you think about the different settings and the options, they're night and day. And sometimes they have a good concept of what they're going to and what it's going to be like, and others they don't. And so we're working on a program where we do strength finders and a few other tools like that to say, here are your strengths, not to pigeonhole them into any specific place, but to say, these are the things that you need in your work environment and that will help bring joy to your practice right off the bat, right out of school. And we feel like doing that will help them be not just a generalist and practice ready, but have a specialty mindset or focus. And also we think that warm handoffs between education and practice are important. And we have another project that I won't go into, but we have another project that we're working on to do just that. And I think we're very hopeful on the first year turnover. And the other thing that I think education hasn't been able to take advantage of is the fact that if I know Carla wants to work in the emergency department, and I know that early on, I find ways within the curriculum, the accredited curriculum, to get those experiences early on. And even if they do assessments with new graduates when they get to service, it's too late to do that. And so that's another way I think we can help with the transition to practice.
Yeah, that's brilliant. I love that. And, you think about that, the role of academia in preparing properly, setting the expectation for practice. Sometimes I so agree with the perhaps unrealistic expectations our novice nurses have going into practice environments. So that's really encouraging to hear. These are the social determinants of learning framework that you have been sharing with us really provides a structure, to coalesce discussions on teaching and research and the influence it might have in supporting diversity, equity, and inclusion. And you write about that in the article. And so if I put this in the context of a podcast listener, perhaps, for instance, me, talk to me about how I, as a nurse educator or a nurse educator researcher, could use the framework to influence my work. In other words, what do I do with this information? Help me to understand the first steps I might take to bring about change in my own work setting.
I'll take this one. I would first want listeners and readers of the manuscript to join us in thinking this is the right thing to do. The umbrella of educational justice is over many of our nation's most significant challenges. And so we would want fellow nurse educators and researchers to join us in this work with a shift in their thinking. So in reading the Future of Nursing 2020-2030 study, I was struck by the language of the call to reset nursing education. And I think, Sue, this is a part of doing just that, shifting our thinking, resetting our thinking to the awareness that student success is not what we have thought it was for all these years in nursing. Yes, the academic support is absolutely essential, but it's not even half of the ballgame of graduating students who will be successful on NCLEX and into their careers. So for me, what to do with this information is to gather with those of us across the nation having this conversation to think about the social factors as significant, more profoundly significant than we have the academic. Yes, there's GPA, and yes, there are standardized test scores that we're looking at. But as Karen mentioned, it goes way beyond that. A holistic admission, this starts with holistic admission, and that is our commitment to educational justice, seeing the student who wants to be the nurse. Then to take that to a very, to operationalize that, we see in that early process, learning about the students. Our method of that is through this CEAP, Chamberlain Early Assessment Program. But whatever, many institutions have very rigorous interviews, et cetera. But to add to that process, all you can learn about the students, the prospective students' social environment. Some of the social factors are positive ones. Some of the attributes that our students bring to us from a social nature are strong attributes. So you learn about why they want to be a nurse, and you see that resilience in them, and you teach them through a mindfulness program how to funnel that grit into productive ways. In our mindfulness program, we talk about taking stock of every day, thinking about one day at a time and all that must be done, not just school, but picking up the children and going to the grocery store, just mindful of the entire day, teaching students to think that way. The research on just the mindfulness program was encouraging to us, that students on into their program noted its impact on their success. So all of that is an attempt to say that we have to know who our students are fully, and yes, support the positive social variables, but then there are negative ones for sure, that then our job becomes helping the students overcome those. Karen's mentioned students who do not have stable nutrition, food pantries on campuses. It's not hard to fill a food pantry. People want to help. That's an example. And certainly support for official food programs, knowing how to direct our students to get the support that they may need. We have students who live in their cars, and just watching a campus rally around that challenge, we can meet those needs if we put our minds to it, that's our role, just like providing an academic resource is. We don't hesitate to order the latest, greatest video series, to help students learn all of the supports that we give academically, just to think about that on the social side as well. And then I would just close by saying, the next step in supporting social well-being is uncharted waters. We want people to help us research and study this. We're focused on 3 or 4 of those 6 domains. We need to understand the environmental, community-based opportunities that we have to help our students. We're studying socioeconomic status among our student body, and recognizing that, just like we say in social determinants of health, the zip code can tell us a lot. Perhaps the K through 12 school was an under-resourced school in that area. So for us, the next big thing is to focus on shoring up what a student needs to be successful in their nursing classes. Creating relearning loops of information that's basic to nursing knowledge. So it does point us back to the academic side of the curriculum. When we want to help solve these social issues, we're also going to be teaching and learning in a different way.
And just to add on to that, for educators, nursing is a caring profession. And what we can do as educators is demonstrate caring to our students. If we don't do that, how do we expect them to be caring when they get to the practice setting? And that means when you have a student who's struggling, not to see them as difficult or a problem, but see them as a gift, that if you can help them through, just think what an impact you're going to have on that person's life, that person's family, their community, and the profession of nursing.
So well said. It's all about presence and intentionality. I just hear that theme come out in your framework, as well as the strategies you're using to address them. So what a gift. Thank you so much. Well, we've come to the end of our time together, and I have really enjoyed this conversation, and I'm grateful for your work, as I'm sure many of our listeners are, that this is a solid way to begin to address some of those areas that sometimes we find nebulous or uncertain about how to address. So thank you for your work. And this brings us to a close. And for our listeners, you can read more about this work in general and get a much more specific idea of the framework in the July-August 2021 issue of Nursing Education Perspectives. Again, developing a social determinants of learning framework, a case study. Thank you to my guests for being here, and the best to you moving forward in your work.
Thank you.
Thank you, Sue.
Thank you.